Today's session is covering taking a bite out of oral care in long-term care, integrating registered dental hygienists into long-term care. About the presenter, my name is Jeanette Smith. I've been a registered dental hygienist for 14 years. I've been a practice owner since 2015. I've completed my Bachelor of Science in Dental Hygiene at University of Detroit Mercy in 2011. I've held a faculty position with the School of Health Sciences in the dental programs at Fanshawe College since 2011. Currently, I'm completing my Master's in Health Studies with a teaching focus at Athabasca University, and I'm a strong advocate for the progression of dental hygiene and reducing barriers for access to oral care. Our session objectives today will focus on the importance of oral health access for residents in long-term care. We'll discuss key barriers faced in accessing oral health care in this demographic. We'll also touch on what makes integrating registered dental hygienists an answer to meeting accessibility needs and provide you with a few strategies for providing accessible oral health care and services. The first thing we'll discuss is being part of the primary healthcare team for seniors residing in long-term care. As oral healthcare professionals, our main objective is meeting the oral health needs of Canadians, which includes those residing in long-term care facilities. The significance of this issue is impacted by seniors who are living longer and with most, if not all, of their teeth. As well as seniors residing in long-term care have significantly worse oral health status than those who live independently. With the demographic shift in the aging population, we will see a synchronous increase in seniors residing in long-term care as well. And according to Statistics Canada, the number of seniors over the age of 65 will only continue to increase, and it is estimated that they will account for 24 to 28% of the population by 2061. This is compared to 14% in 2019. Although there are many contributing factors to accessible oral care, this presentation will focus on key barriers of accessibility, such as access to adequate daily oral care from facility staff and dental services carried out by oral health practitioners. Although facility staff play an active role in addressing the daily oral health needs of residents, seniors are still experiencing inequity in oral health care access. This is made challenging by staff shortages, increased workload, limited time given to client care, and a lack of access to proper staff training. The interventions and protocols currently in place are making little to no impact on the oral health status of long-term care residents, as they are not being implemented by facility staff or healthcare practitioners. As dental professionals, we are aware of the oral health disparities faced by not only seniors residing in long-term care facilities, but by all marginalized populations. However, knowing this disparity exists, oral health professionals fear there is still a knowledge gap with allied healthcare professionals, contributing to the lack of oral care being accessed. One perception expressed by dentists in providing oral health services are quoted as saying, "The dentist is running a business, and they try to get patients in and out as quickly as possible." This perception alone will hinder reducing the oral health disparities of seniors living in long-term care. Therefore, registered dental hygienists play a unique role in addressing the oral health disparities of Canadians. Prior to legislation changes, individuals seeking dental hygiene services would have to be examined by a dentist first, and an order would be given for the registered dental hygienist to perform these services. In order to increase public access, provincial legislations have made amendments to this order, allowing registered dental hygienists to self-initiate dental services by removing barriers of seeing a dentist first. With the growing number of self-initiated registered dental hygienists in Canada being recognized as primary healthcare providers, we are able to play a pivotal role in providing accessible oral care to residents in long-term care. One question you may find yourself asking, where do I start? In order to provide the appropriate level of care and services, long-term care facilities are required to have a support staff consisting of a variety of healthcare providers to meet the needs of residents. Requirements are outlined by both Ministry of Long-Term Care and the Canadian Dental Association, which include oral health assessments completed by an appropriate, trained, licensed, registered healthcare professional upon arrival and annually, a daily mouth care plan, and suitable infrastructure to support the delivery of oral care to residents. In order to provide the appropriate level of care and service, two basic approaches will be discussed today and can act as a stepping stone to integrating into the long-term care facility team. We will touch on providing oral health care services for residents and facilitating staff and education training. With providing oral health services, one way this can be done is conducting the oral health assessment tool. Each resident must receive an oral health care assessment on arrival to the facility and on an annual basis thereafter. This assessment tool can be accessed through the local public health unit and is easily implemented. It also can be found at the end of the reference list of this presentation under the Dalhousie University 2011. This tool is unique as registered dental hygienists are trained to identify oral health conditions and variations from normal. Any concerns found by the resident or the RDH can be communicated with staff and the power of attorney for future treatment needs. Providing direct care is another service that can be provided by registered dental hygienists. Being self-initiated, we can provide this direct care to residents, which include debridement, periodontal therapy, oral hygiene instruction, application of fluoride varnish to prevent cavities, and anti-carcinogenic agents, which aids in reversing early cavities, especially on root surfaces, which we see in long-term care. With facilitating staff education and training, there's one good resource guide that is available called Brush Up on Mouth Care. This resource provides the facilitator an individualized, easy-to-navigate oral health care plan for the facility. This resource can be implemented by the registered dental hygienist or given to the facility to conduct training by staff on site. It provides education videos, information on how to provide daily oral care, introduction to oral health care toolkits for resident bathrooms, and much more. When seniors, especially those with limited access to care, are provided adequate access to dental hygiene services, improvements in the oral health status can be seen. In as little as 6 months, residents in long-term care can show a cessation or reduction in periodontal disease and active caries when provided professional cleanings regularly and daily oral care is performed by properly trained facility staff. When these new protocols are in place and followed, long-term outcomes show a 53% stability in residents' oral health status. Research shows the need is there. Are you ready to take an active role in integrating into the long-term care team? Thank you for listening to my presentation. The floor is now open for any questions.